Hey guys, I'm back. I want to redo my video. Earlier in the day I posted, well, not earlier in the day, yesterday. I posted 3 videos and I was basically trying to put some information out there for y'all to kind of understand what was in Kenneka's autopsy. And the way it turned out was not my intentions. I didn't mean for it to not be clear, because on my end, when I was putting it together, yes, it was clear, but once it hit YouTube, it was a little bit blurry, sort of like some of those videos we saw where you can see like motion and they say something like, oh, look here, you can see X, Y, and Z, and there's a big blur and you really don't see shit. Well, I didn't want my video to be like that. I basically want you to be able to see everything that I present. I want to be able to explain it, and I just want y'all to understand what was presented to us. I just think that autopsy was just not detailed enough. I think it was just fitting the situation on the behalf of the police officers and on the behalf of Crown Plaza. And when I say that, and what I mean by that is, yes, we understand that this young lady died in this hotel. I think it was more so protecting the hotel and the police officers more so than revealing the truth of her death. And when doing autopsies, and when you're just like regular people like me, you, and people that didn't go to school for this, we would see this stuff. We know something ain't right, but we just don't know what it is that's not right. So with that being said, I'm going to start with my little presentation that I gotta manually do and explain to y'all what was actually in this autopsy. Stuff that we would have never picked up, because of course we're not coroners or medical examiners. We're not pathologists. This is not our profession. But I did do research. I do have proof. I do have where I got the information from. So I'm not just throwing stuff together just to make it sound like I know what I'm talking about. I'm going to have backup. Okay, I'm going to be asking questions. I may have the same questions you have, or it may be something you always wanted to know but just wasn't sure, and it may show in my video. So with that being said, I'm going to start, and I hope that you all like my video. And just understand, I'm doing this because I really want to help the family. I know there's a lot going on. The situation made different turns. You have positive people trying to help, and then you have negative people tearing this family down. At the end of the day, somebody died that didn't deserve to die in the way that they did. And I feel that people taking a situation and it's almost like making a mockery out of it. People bringing up all different types of situations and things that may not even be relevant to her death. Like, it's just, a bunch of shit. Don't get me wrong, it's some good videos out there. I'm not hating on nobody. I'm not knocking nobody. I would never do that, because that's just not me. All I'm saying is so many videos out there, you don't know until you look at them who's trying to help and those who just bashing or just need something to put out there, because of course everybody wants views and they trying to get whatever they're trying to get. Me, on the other hand, I'm just trying to put some information out there that could possibly help, and hopefully this video reaches her mother, and whatever questions that she has, she could possibly get the answer through this video, and maybe move forward and getting another autopsy done, because I think it's needed. maybe other people will reach out to her to reopen the case. You know, who knows? Like, I'm going to do the best I can. But I'll tell you this. After this video, and depending on what other fishy information I come across, this probably be my last video on this topic. I don't want to ride on it. I'm not going to continue to ride on this video. I'm just going to try my best to present to y'all what I think and how I feel and what I see, and point out the things that, you know, it wasn't meant for us to see. So, moving along. What was the real cause of Kenneka's death? Did she die by strangulation, suffocation, or hypothermia? Once y'all get through this video, once I get through this video, then y'all probably be able to determine what really happened to this young lady. It's going to be hard to determine. I'm going to tell you. It can go so many different directions once you really see what's in it. But I think it's a sad situation because it probably didn't have to end the way it did. I think there was a possibility that she could have been saved if she died by hypothermia. Having hypothermia, like, yes, people do die from it, and time is something that you can't waste any time. It's an immediate situation to attend to. So by them not attending to the situation as quickly as they did, that was one of the contributing factors of her death. Okay, I'ma just keep it real. They can say whatever they like. She was drinking, she had alcohol in her system and drugs that contributed to it. No, what contributed to her dying is them not responding as quickly as they should when they were first notified that she was missing. Okay, we're going to get that in the opening. Here is first aid for all cases of hypothermia. Alright, so basically this is the proper protocol when finding a person who might be suffering from hypothermia. As you can see, it gives you tips on what to do. The first step, and I'm gonna try, I don't really want to read through everything because, you know, y'all can read it. I may skim through some of it, but I just want to make sure that y'all get the information. Okay, say the first step in all cases of hypothermia is to prevent any further heat loss. This is done by removing 4 ways that the heat loss mentioned earlier, including, now when it say earlier, I think what happened is I have other hypothermia information on here, so I might have put this first when I should have put it last. So that's probably why, you know, it turned out the way it is. But at the end of the day, all the information is good information. All tips are good, and it's all going to lead into the same thing. Okay, they say conduction, which is remove the person from the cold surface as possible. Basically, get her out the freezer. That's what that means. Conduction is remove Kenneka from the freezer so that she can no longer be cold. Okay, that's step 1. Here, convection. It says remove the person from a windy or wet environment. Radiate. I'm not going to read everything. I did say that. Radiation. Cover as much of the person as possible to avoid radiant heat. Particularly cover the head of a younger child. Okay, well, she wasn't young, but we do know if in any case a child is hypothermic or whatever, going through hypothermia, then we know you have to cover the head. Evaporation. Wet and sweaty people will suffer evaporative and remove wet clothing as soon as practicable. So basically, if a person is wet, take the fucking, I'm sorry. Let me try to sound a little bit more professional. Take the wet clothing off of the person. Okay? Kenneka did look like she was wet in the freezer. You know, you see wet marks on her jacket or so. these things here could have saved her life. That's why I'm putting it out there. So just think about it. Everything you read, just put in mind of what Kenneka was going through during these times and what could have been done, what should have been done. Let me rephrase that. What should have been done to help this young lady, to save this young lady if possible. Do all you can. I'm gonna move to the next one. Don't massage or rub the person, and do not allow them to help you. Keep them still, because particularly below 32 degrees Celsius, they risk a cardiac arrest. I hope y'all be able to see everything. Once again, move the person out of the cold. So we got that. If this is not possible, protect them from wind, cover their head, and insulate their body from the cold ground. If the person is moderately or severely hypothermic, move them as gently as possible. Below approximately 30 degrees Celsius, the heart is very vulnerable, and there are case study of simple movement like rolling the person over, prompting a cardiac arrest. Again, remove wet clothing, replace with dry covering. So basically, you want to get them out of the wet clothes and try to get them into something dry. Remember, they're cold. Wet clothes are only going to make them colder. Okay? Wet clothes and sweating and all of that just going to make matters worse. So they basically saying reverse all of that. Whatever's going on with the person, get it off. Take it away. Replace it. Try to warm the person. Do not use hot water immersion. So you don't ever want to stick a person that's suffering from hypothermia into extremely hot water. Now, I truly understand where they're coming from with that, because, just a little, extra information. Back when we were kids and we used to play in the snow, we would, if you didn't have gloves, or even if you did have gloves, your hands get cold. Once your hands freeze, you feel that numbness or whatever. You run in the house, and as kids, you don't know not to put your hands on a heater. You put your hands on the heater, rubbing them together and shit, and it start feeling like tingly, and it start to hurt and feel strange. Well, basically, they're saying don't do that shit. You do not take a person that was in a freezer or in the snow or anywhere and immerse them into extremely hot water or water that's too hot. Okay, I think it just makes matters worse. Insulate them from the environment to retain whatever heat they are producing. Use whatever heat source is available. Okay, you have blankets, you have warm water, whatever the case may be, whatever heat source you have available, use it to warm this person up. The point of it all is to try to bring the body temperature back to higher, at least higher than 32, until it gets to a normal temperature. But that's basically the goal, is to warm the person up, get them out of the wet environment, get them out of the cold environment, get them out of the wet clothes, and try to warm them up. These are the things that needs to be done. All right. This is a lot to read, so I'm not going to read it all because I'll be forever trying to get through this video. But gradually warming is ideal. And whatever heat source is used only has to be warmer than the person to be donating the heat. When applying heat close to the skin, such as with hot water bottles or heat packs, be careful not to make them too hot, as a person may have impaired sensation. So that must be that sensation that we would get when we were kids and played in the snow and then put our hands over the heater. It must be that sensation. But basically, you want to get them out of the cold. You want to warm them up gradually. You don't want to just forcefully fast and just trying to warm them up, because it's going to make matters worse. They have to gradually get their body temperature back up. Don't give alcohol. It lowers the body's ability to retain heat. If the person is alert and is able to swallow, have them drink warm, non-alcoholic beverage. Do not offer liquids if they are vomiting. So, yes, you don't want to give them, if they're up, you want to give them warm beverages, no alcohol. If they're vomiting, don't give them anything. I guess, of course, you want to get the vomit out. You don't want to have them swallowing and drinking liquid and vomit at the same time. Like, you know, that's common sense. But some people, not everybody have common sense. Do not leave a person alone. Stay with them at all times. Continually to monitor the breathing. If the person breathing stops, start cardiopulmonary resuscitation, CPR, immediately if you are trained. If unsure, dial 000. Operators will advise you what to do. Continue CPR until the person starts breathing on their own or until medical help arrives. I don't know how many of y'all had CPR, but I know I did. And that's just one of the rules. Once you start CPR, you can't stop. So it's always good to have a partner. It's always good to be able to switch back and forth, because basically they're saying you just can't stop doing CPR. And sometimes people don't get revolved that quick, or, you know, it takes a while. And you may lose, you know, you may run out of breath giving CPR to someone else. But these are the things to saving a person's life. And it says here, the last one, don't assume the person is dead. CPR can be life-saving for a person with severe hypothermia who may appear to be dead. I'm sorry for that feedback to be in the way when I got the picture, you know, when I screenshot. Somehow I wasn't able to get that out, but basically they're saying don't assume the person is dead. They may appear to be dead, but, you know, they're not breathing the way they should, but they could possibly still be alive. So proper protocol for when finding a person who might be suffering from severe hypothermia. Now, the one before was for all stages of hypothermia. First, second, third, mild, moderate, severe, whatever you want to call it. That's what that was about. This here is for severe hypothermia. Okay, once again, it says, an emergency, call 000. While waiting for help to arrive, monitor the person. All the things that was done before. Nothing too different. Begin CPR. Immediately, the person shows no signs of life. If they are not breathing normally, are unconscious, or unresponsive, or not moving. So if they're not showing signs of life, immediately perform CPR. Once again, it says never assume a person is dead. A person with severe hypothermia may only take 1 breath per minute with a heart rate of less than 20 beats per minute. Always assume they are alive. Again, never assume a person is dead. A person with severe hypothermia may only take 1 breath per minute with a heart rate of less than 20 beats per minute. Always assume they are alive. That is for severe hypothermia. We did all stages. Now we at the point where severe hypothermia may be the case for a person. And even still, you don't want to assume that that person is dead. And I think I'm saying it again because that is one of the most important things when someone is suffering from hypothermia. You never want to assume that the person is dead, and don't assume that the person is dead. These two phrases, I'm just repeating it because I don't understand why when they found Kenneka in the freezer. I'm not even going to say it because I know that I mentioned it as I go along. But I'm going to ask, do you think any of those steps have been performed upon discovering Kenneka? And I'm saying, this is me, I don't think so. The reason why I don't think so is because these are the reasons why I don't believe it was in a postmortem exam either. I don't think they performed any of the CPR techniques or tips. And I don't believe it's in a postmortem exam because, let's go. Number one, on September 10th, 2017, at 5:35 a.m., the police officer stated that the subject, talking about Kenneka Jenkins, was frozen solid. The date and time that the postmortem exam was performed, it was done on the same day Kenneka was found in the freezer, which was like approximately, 4.5 hours after she was discovered. And the third thing is the postmortem examination stated that Kenneka was not frozen. But according to the police officer, Kenneka was frozen solid. So basically, maybe they did thaw her out some when she arrived. Me personally, I don't think if she was frozen solid that she was thawed out fully, to get the postmortem exam done. I think in a situation like that, they needed to, wait a little longer. And that's why I feel that this autopsy was just bullshit, because I did read somewhere that sometimes it can take up to about a week to thaw a person out. I didn't put that in my slides because I couldn't find where I saw the information. And the information, matter of fact, let me take that back. I found it, but it was through a conversation on one of those forums. So I didn't want to take what took place in a conversation. I wanted to get information from like real credible resources, factual information from people that do researches and really know, and from good websites. I didn't just want to put anything out there. So I ain't posting things that I got from websites that is credible websites. Okay, my question is, upon finding Kenneka in the freezer, did they follow proper protocol before pronouncing her dead? There are steps to possible saving someone's life who could be suffering hypothermia. For those who are not aware or familiar of these steps on how to provide first aid care to a person with hypothermia, you may want to pay attention to the next few slides. Now, okay, basically what I'm doing is trying to get into a comparison. I'm going to show you 2 autopsies on people who died from hypothermia. I want you to look at the dates. I want you to look at the time of when they was pronounced dead or when they were documented to be dead, and the time that the postmortem exam took place. And I just want you to see how they handle the situation when finding these people. Well, at least one. I do have one person that, you'll see where I'm going at when I show it, but I'm just trying to point out some mistakes that was made when finding Kenneka. Okay. Hypothermia death. You may want to, I said you may want to pause before continuing, but being as though I'm doing it manually, we don't need to pause. Okay, let me try to move it up so that y'all can read Carrie, what's his name? McSorley's just a portion of his autopsy. Time of death was February 13, 2016 at 19:25. The date of the autopsy was on February 14 at, I guess, 9 o'clock. It don't really say, well, I guess 900 hours is 9 in the morning. But they found him he died, he was pronounced dead at 7:25. So let's see, 7, 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6, 7, 8, 9. Even this, of course, I knew it was more than 4.5 hours. I just wanted to see just how many hours it took for them to perform the autopsy. And not only that, when you read what's in here, they could have been did the autopsy, but they had their own way of doing things. But let me just read. It says circumstances of death. The descendant is a 30-year-old, 30-year-old, date of birth 10/8/1985 male, who was found stuck under a chain link fence by passerby on the morning of February 13, 2016. The descendant appeared to, where I'm at, because I'm losing my spot, have been climbing under the fence in a supine position. A backpack belonging to the descendant was on the other side of the fence. He appeared to be hypothermic despite aggressive resuscitation. Okay, meaning they did the CPR and all the things they needed to do to try to save this 30-year-old life. Efforts, including, ECMO and laparotomy. The descendant remained on life support until the family decided to withdraw care. Okay, this person was stuck under a fence. Okay, somebody found them. They must have called 000s. Rescue squad, whatever, came out to try to help him. They probably warmed the body like they say to do. They did CPR, aggressive CPR. They did everything. Got him to the hospital. Wasn't able to get the whole entire autopsy on here, but I'll say this. Pull his name up and you can read the rest. But I just wanted to point out how his time of death was on February 13th. The autopsy was done on the 14th. But at the same time, he was in a hospital for about a week. They made sure he made it to the hospital. Like, why wasn't none of these things done with Kenneka? When she was found in a freezer, supposedly frozen solid. Why didn't they do aggressive CPR with her? Why didn't they try to warm her body? Why didn't they try to transport her to the hospital? Basically, the question is, why the fuck they didn't try to save her life? Okay? That's what I want to know. But you see, from the the first aid tips or whatever, to for trying to help someone with that's suffering hypothermia, these people did it. Next page. This is the guy. I just wanted to show Kerry Andrew McSorley. Okay, date of birth, day that he died is right here, age 30. This is who was stuck under the fence. This is who they did aggressive resuscitation for. This is who made it to the hospital and was on life support for a week until his family said, that they can take him off, that it wasn't no saving him. His family had an opportunity to view their loved one. They understood what was going on. There was no tricks. There was nothing, no funny business or anything. Oops, I am so sorry, y'all. That fell. No funny business or anything with trying to, you know, with this young man's case. But I will say he made it to the hospital. Next autopsy. Basically, the time of death was February 23rd. The autopsy was done on February 24th. So, again, the autopsy was done a whole day later. Not even with, not 4.5 hours, but a whole day later. And they, you know, he had a little history where, from what I understand and from what I was reading, he had a situation going on. But my point of this is the time. How is it that, you know, he can die of thermia on the 23rd or whatever, and they do his autopsy on the 24th. But with Kenneka, she get found 5:35 a.m. and then 10 o'clock that same day, I believe, if I'm not mistaken. I gotta look at her autopsy again, but I believe it was the same day, which was 4.5 hours later, they were able to perform a full autopsy. And we wonder why it was inconclusive the first time, because she was still, if she was frozen, I'll say her organs were still frozen. You know, it wasn't thawed out to the point where they could get accurate, testings and, you know, do whatever they need to do, if that's the case. Like, we don't know. It's just so many sneaky underlying stuff going on with Kenneka and this autopsy stuff. But I just wanted to point that out. And that's why I said, just making a point. I'm sorry, I'm trying to get to all of my slides. Carrie McSorley and Kenneka Jenkins both found in a cold environment. No time frame stated on how long Carrie was stuck under the gate, but as we see, he did receive first aid for hypothermia before being transported to the hospital, where he was put on life support. He stayed on life support until his family decided to take him off. Kenneka, on the other hand, did not receive the same treatment for hypothermia, because if she did, she would have been taken to the hospital where her family could have had the same opportunities as Carrie's family. Better yet, she probably would have been alive today had they treated her with dignity and respect. Instead, she get a free photo shoot inside a dirty-ass freezer. Both Carrie and Kenneka had drugs in their system. Kenneka's was not of lethal amount, but Carrie's family admitted that he is known to abuse drugs. So, again, it's just sad how, you know, and I don't want y'all to think I'm trying to make this a black or white thing. You know, still 2 people died. It's just sad how they did what they had to do. And I mean, they went in the same location, but at the end of the day, when you are the authorities, when you are an emergency, work for, like, you know, the emergency, what you call it, I'm sorry, you know, goodness, if you're a doctor, if you're the ambulance, the EMTs, that's what I'm trying to say. Oh my gosh, I hate when I can't get stuff out and I'm in the middle of doing something. The EMTs, anybody that's trained to provide treatment and care for someone that's in danger of dying or could be dying and not get that treatment, that's a sad thing, you know. I really feel that this young lady could have been saved, but that's why I think the autopsy was all created and made up for this purpose, because they didn't do the things they needed to do. Okay, this is, okay, this Sean Stagg's autopsy. I wonder why. Let me just go back real quick, y'all. I'm sorry. I put it on here twice. I didn't mean to. I apologize for that, but I'm just going to pass it. Because I had to do this over, and if something is out of line, my apologies. Once again, I wasn't able to put everything in. I'm not going to read that. That's not important. It was important when I did my little slide, but it didn't even last long. Alright, so do you think any of those first aid treatments for hypothermia was performed on Kenneka Jenkins when she was found in the freezer? I really doubt if they even tried. They just assumed she was dead. They know they fucked up big time, and that's why the case was closed so quickly. Now let's review a portion of Kenneka's autopsy and see what we can figure out. Now this is the interesting part. Now the first piece was understanding all the hypothermia thing and how you treat someone with hypothermia, the steps that need to be taken, all of that stuff. So for her to be in that freezer the way she was, we already know that did not happen. Okay, because the type of photos we should have got was her inside of a blanket. We should have got photos of her out of the freezer. We should have got photos of her, of them trying to warm her up. Those are the photos we should have got. But because they assumed she was dead, they felt like, hey, let's just take a picture of it. It's now an investigation of a crime scene. Because that's the only reason why they took the investigated it. Because they knew she didn't die of hypothermia. They knew it was criminal. They knew it was a murder investigation more so. But they had to protect themselves because they didn't properly do what they needed to do. Okay, I hope I'm not losing y'all. I'm really trying my best to explain this in a way, not saying y'all don't understand, but I think we kind of lost focus on the scene. Yeah, we got photos of her in the freezer laying face down and then sitting up, and you know, we got those photos because she was probably dead by then, and of course she would be dead by then because they didn't follow the proper protocol to prevent that. Okay, I'm gonna just move along because I don't want to end up saying something that's probably a little further down the line, so let me go ahead. Now, do anything stand out or look strange in this portion of the autopsy? Well, let me point out what I see and what I think is questionable. So when we get into the autopsy, you're going to see a lot of things underlined with purple. And I only did that out of, you know, respect for Kenneka and, you know, being her favorite color. I said I'm going to use purple because I'm really trying to dig into this, and I just want to show y'all the situation. So right here, like I mentioned earlier, it said the body is cool following refrigeration. Rigor mortis is well developed and symmetrical in the upper and lower extremities, neck and jaw. Fixed red-purple lividity is present on the left anterior and posterior surface of the body. Except in areas exposed to pressure, the body is well preserved and is not embalmed. Okay, if somebody is found in the freezer, I believe the body would have to be well reserved. But I underlined red-purple lividity is present. Okay, when I read into that, when I researched lividity, it stood out like a sore thumb, because what I'm about to show you is this can't be possible if she died of hypothermia. Okay, it says typically postmortem lividity appears as a bluish purple. So that's her. The red, purplish color, bluish purple. That's the typical color of a person's lividity when passing away. color region in the body that are in close contact with the ground. So the livity is the postmortem staining. When you pass away, the blood settles to the bottom, and that's where the livity is located, you know, is the blood. Okay, death due to intense cold, hypothermia, or the refrigeration of a recently deceased body will produce a bright pink livity. So what I get from that is, if a person, if death is due to intense cold or refrigeration of a recently deceased. So if somebody was deceased and put in a refrigerator, and I didn't catch on to this earlier, but now that I'm reading it the way I'm reading it, it seemed like if the person died from hypothermia, their livity would be bright pink. Or if a person died and then put into the freezer, the livity would turn bright pink. Now, I could be wrong, but that's how I see it. You know, you may see it a different way, but it's saying deceased body will produce a bright pink color. So how is that hypothermia when her livity was what color again? Red, purple livity. Hypothermia, deceased body will produce a bright pink livity. It don't match. So that's question number one. Where do they get that from? Why is her livity not bright pink? Why is it purple if she died of hypothermia? Stuff like that stands out, but if you don't know, you won't question that. You'll be sitting there trying to figure out, well, what is livity, if it means, and what do it mean? You know, they can tell a lot by livity. The livity can also be used to help determine if a body had been moved from one location to another. If the body show different patterns or have livity, different patterns, or have livity on the, it would have livity on the area opposite of the body. Settle. Okay, I might have wrote that wrong. I apologize. I put it on the phone. Y'all may be able to interpret what I wrote better than me. But if the body show okay, that's what it is. If the body show two different patterns, or have livity on areas of the body opposite of where the blood settled, means the body was moved. I do apologize. I'm trying to read this. I'm trying to stay focused. But basically, that determines if a person was moved from one location to the next, because the livity would be in a different pattern. Now, I will say, looking at her pictures, and I don't have one on here, but I'll find it later if necessary. It looked as if, and that could be from being cold, but I doubt if it's that. But the right side of her, what is it, abdomen, near the stars, if you look at that really good, the next time you look at her photos, it looks purplish. Okay. Livity wouldn't be on that side if she's found face down. The livity would be on the side closest to the ground. But it looked like she had some discoloration or something in that area. Or it could have possibly have been some bruises. You know, we don't know what it is. But that's what I mean about the autopsy not revealing everything. You know, trying to figure it out. We may come across some things, and I feel like there's one or two things. Either she was moved, and that's why the area is purplish, or it's a bruise. And I did see a bruise in that area. I can show you later, but you know what? It's not on here. I'm not going to do a whole video trying to find it. You know, I can probably go through my pictures and look for it, but I'm not going to do that right now. All right, moving along. All right, now this may not look weird to y'all, but like I said, I underlined all the things that stood out to me. The eyes are closed, the corneas are clear, and it says the conjunctiva or conjunctivae are mildly hyperemic. and free of Pt1 and bulbar. Well, basically, I just felt like those things didn't really make sense. I'm not saying that her eyes couldn't be closed, because we did see photos of her eyes being closed, but I'm gonna get into that in a few. Yeah, I did read that when a person die of, I believe, hypothermia, their pupils get dilated, but that don't mean that your eyes shouldn't close. But I don't know, it's just I was just trying to put some things together, and I'm not trying to reach when I say this and trying to just make things up. Like I said, I have information that will make you think differently than the stuff that they are revealing to us. You know, they let the whole world see. All right. So I just basically numbered 1, 2, 3, the color liberty, the eyes being closed, and the conjunctivae was mildly hyperemic. Eye closure during death. I researched that. Okay, studies of the estimation of postmortem intervals, spontaneous opening and closing of the eyelids after death, and then just say who's the author that's translating this. Okay, the authors have investigated the findings of 410 cadavers, which were subjected to medico-legal autopsies in our laboratory, as to whether their eyelids were open or closed at the time of the autopsy, and have come to the... Sorry guys, my video kind of stopped. So I'm going to try to continue from here. Let's say causes. These are the most common causes that lead to the appearance of conjunctival hyperemia. The causes would be exposure to irritating substances, chemicals, dust, and debris. Conjunctivitis would be from like infectious, bacterial, viral, gonococcal, I'm gonna say that because that's the only way I can see it coming out. And chlamydial. Recurring chronic conjunctival hyperemia, allergic, direct exposure to different allergens, pollen, dust mites, or dander from pets. It can also come from trauma or eye injury, endogenous ocular health problems, suggestive of a systemic disease, inflammation of the eye, scleritis, or episclera. Oh, goodness. Y'all figure the word out. If I'm pronouncing it wrong, and the ones that know how to pronounce it right, you know exactly what I'm trying to say. So moving along. Leads to the dilation of the blood vessels in the eye, commonly associated with, and I think I might have accidentally cut off some of the information. I hope I didn't, but we'll see. I sure did. Unless I didn't get the very next clip, because I had to do it manually. But like I said, I'm putting out information. Y'all can pretty much do some research on your own if you choose to. But I'm glad to get to this point. Next, I'm going to reveal that there was some suspicion of neck injury. This is also very interesting. Alright, the real reason for the cover-up is because the authorities mishandled the evidence, as well as not responding to Kenneka as a person who was exposed to extremely cold to an extremely cold environment. Let me make sure I got it all. This is where the ordinary people like you and I miss the truth behind the autopsy, because for one, we don't fully know or understand the purpose of the autopsy. Being as though I did some research, I'm going to try my best to explain to the world why it's important to know what's being presented to us in these autopsies. Here is some basic information that may help you follow along, but you can do your own research whenever it's convenient for you. Okay, I'm going to provide some information. Here it says internal exam. General. It say this is usually where the money is in a hospital, which is the autopsies. Like surgeons say, you should never cut anything until you're sure what it is. So they have to be sure before cutting any parts of the body. And they say that because you need to know where to start your cutting, where to start your first incision. Okay, so it say before the first incision, if there is suspicion of pneumothorax, the three followings can be done. It say create a pleural window between ribs. Are they just giving you basically steps 1 to 3 on how to do an incision if someone have pneumothorax? Okay, but what I highlighted in purple is what I wanted to basically discuss. All right, it say if there are neck abnormalities or suspicion of pressure on the neck, it is prudent to remove the cranial content and thoracic content before doing the neck dissection. If the above does not apply, for an example, there is no neck injury, suspected neck injury, the tongue and neck can be taken together with a thorax pluck or organ pluck. So, basically they're saying if there are suspicion of some neck injuries, or if there any type of, let's see, if they suspect neck injuries or any neck injury, whatever the case may be, they have to first remove the cranial content and the thoracic content before the neck dissection. So you have to do those two things first. And I'm saying it this way because when we look through this autopsy, this is what we're looking for. They must remove cranial and the thoracic cavity. Okay. It's a incision. Okay, we know the Y-shaped incision is standard. Superior port, they just, showing us how, telling us how the incisions are done. Chest plate. Remove by cutting the ribs. Also, at the rib end, ribs should be examined for fractures, usually of no interest. Notes. The sternum may have cleft or foramen as an anatomical variant. If the descendant has a history of CABG, removal of the chest plate should be done. Neck organ pluck. Okay, this is for non-suspicion cases when you do a neck organ pluck. Trim tissue posterior to horn of the thyroid. Cut between the thyroid horn and hyoid. Cut off base of tongue. But of course, me, being a person I am, I highlighted the suspicious cases. Even though they say in Canada it is convention to do layered neck dissection. They're just saying Canada, this is what they do regardless. Okay, but we're talking here. So you have to do, in suspicious cases, you have to do a layered neck dissection. It say the strap muscle of the neck are lifted in layers to look for injuries, mostly contusions. Strap muscles, hematomas may arise in a number of contexts. For example, they are reported in drownings. Okay. So once again, these are, oh shoot. I'm sorry, y'all. I don't try my best not to move it too much. These are the signs or some of the things we're looking for into this autopsy, because this is going to let us know exactly what was going on with Kenneka. Okay, I think y'all kind of get where I'm going at with all of this information. All right, it say hyoid bone is the reason why. Let's see. Important in forensic pathology, fractures are seen in manual strangulation. May appear fractured in tracteous cartilage or tracheal cartilage is present. All of these words. Tracheous cartilage may be confused with a fragment of hyoid bone. Tracheous is pronounced tracheous. Okay, so I should have read that first and then started reading the paragraph. These, all right, larynx injuries. Okay, we're talking about neck injuries. Larynx injuries. These are worked up in great details in Germany. So they kind of like tell you in Germany and Canada, like how they do things. I think autopsies are performed in different manners due to different situations. And then in some states or countries or whatever, they may do a autopsy in the same manner all the time, because no matter what, this is what they're looking for. They may have suspicion of things no matter what. So it's in Canada, the examination by comparison is superficial. A detailed examination of the larynx may offer significant information in its fixal depth. Pre-evaluation, if the larynx injury is suspected, the larynx should not be open. Soft tissue should be removed with blunt dissection. Evaluation done with a stereo microscope. Tension, splits, tears, and bleeding. Compression, surrounding tissue, no splits or tears, and partial fractures. Give informatic about directionality. Should have made that bigger so I can read it. Now I'm saying if there's no neck abnormalities or suspicion of pressure on the neck, these are the expected steps. Oh my gosh, I need to go to sleep and wake up and do this tomorrow. If there are no neck abnormalities or suspicion of pressure on the neck, these are the expected steps. Remove the cranial content. Remove the thoracic content. Then the neck dissection. These are the steps that need to be done when doing an autopsy of suspicion of neck injuries or neck abnormalities. Okay? I'm pointing this out for a reason. Internal examination. Okay, it's a body cavities. The body is opened by the usual thoracic abdominal Y-shaped incision, and the chest plate is removed. So, why is the chest plate removed? Because earlier on they said it needed to be removed. I think I put it in there again just so that we could, you know, follow along. It say no adhesions or abnormal collection of fluid are in any of the body cavities. All body organs are present in normal anatomic position. The subcutaneous fat layer of the abdominal wall is 2 centimeters thick at the umbilicus. I tell you, pronouncing these words and doing this YouTube thing is a bit much, but I'm going to put it out there. I'm going to get through this. And, you know, if I'm confusing y'all, once again, I apologize. If y'all following along, that is good. That's great. Because I am really trying to help y'all understand what we're reading in this this postmortem exam. You know, we read things that stood out, you know, oh, missing middle lobe, the obvious. That's what we looked at, the obvious. Well, we need to look at the whole entire, okay? So I circled chest plate is removed, okay? Just keep in mind the steps that needed to be taken before you do a neck dissection. And all of these have to be done in that order, in that manner, if there are suspicion of neck injury or neck abnormalities. This is my point. This is why I'm trying to make sure I emphasize certain things and highlight certain things, because we need to know this. This right here is one of the signs, you know, one of the details that we wouldn't have known what that meant. Chest plate is removed. We know they do that in any autopsy, or don't they? You know, it's many different ways of doing autopsy depending on the death and when, where, why, like all those questions, all those things, you know, matters when doing an autopsy. It states that there are no adhesions or abnormality. I'm sorry, I said abnormality so many times. I'm just saying it. No adhesions or abnormal collections of fluid in any of the body cavities. Let's take a look at all the body cavities. The body cavities consist of the followings. Now, before I go into that, originally I was thinking all the body cavities from head to toe. Okay, they're saying there's no collection of fluid of any kind or whatever, no abnormal fluid in any of the body cavities. Any of the body cavities mean any part of the body that's considered to, wait, how can I put it? The body cavities in different locations of the body have, I guess, some sort of fluid. Maybe it shouldn't have fluid, or maybe the fluid in there, it should be of normal amount, maybe thickness, thinness, or whatever, you know, whatever description it's supposed to be. It shouldn't be different than what the norm. So I'm trying my best, y'all. Stick with me. All right, the body cavities. I believe this is what they're talking about. The cranial body cavity and the thoracic in the middle. Okay. Ooh. I don't want to. Please don't mess up. All right. So I guess when they said there were no abnormal fluids in the body cavities, they were only talking about these two. But that's misleading, because they said any of the body cavities, and the body have more than just those two cavities. As you can see, it have the cranial cavity, it have the dorsal body cavity, vertebral cavity, thoracic cavity, abdominal cavity, pelvic cavity. They have all these cavities, and they mainly said there were no abnormal fluid in any of the cavities. So I'm thinking whole body. Okay, maybe they're thinking just those two, but I'm thinking a whole body. Now, the reason why I'm pointing this out, because we need to understand what they're doing and how they're misleading us, you know. Make it darker. I hate that reflection. All right, let me try to. Why is it doing this? Something in the way. Oh gosh, why? I'm sorry for that glitch. I'll say nobody's perfect, but I'm more than sure you'll be interested in all the information that I'm putting out there. All right, head. So they did the they did the body cavity, the thoracic part of the autopsy. Now we're doing the head. Okay, we examined that. Let's examine this. Okay, y'all can read all of that if you want. But I underlined the cerebral hemisphere are symmetrical with mild edema, as characterized by flattening of the gyra and narrowing of the sulci. Okay. Mild edema. Okay, that is fluid. That is abnormal fluid. That's excessive fluid, and that is in one of the cavities, I guess, the cranial cavity, or maybe it's not considered to be in a cranial, but any way you look at it, it is a form of fluid that's excessive, that shouldn't be there. So that's why I said when they said there was no fluid, no abnormal fluid in the body cavities, I'm thinking of the body as a whole. And I'm looking at the edema, the mild edema in the cerebral hemisphere, which is located in the head, because they're doing a head dissection piece right here. And when that happens, from my research, the flattening of the gyra and narrowing of the sulci, I guess, is what the edema causes. Like, if the edema wasn't there, I guess that wouldn't be. I can't really explain all of that to a T, but it makes sense when I read it. But still, they did the thoracic dissection. This is the head. Okay, remember it was steps 1, 2, then 3. And the edema is just excessive fluid that shouldn't be there. So how did it get there? I believe the further I get into the video, it'll come up, because I tried to get all the information. I don't want to lose y'all, so I'm gonna move on. Okay, from what I'm seeing, this autopsy, postmortem exam, none of the gross findings match up with the hypothermia death. If there are findings that could be from hypothermia, it could also come from something else, and I'll point them out as I go. So basically what I'm saying is, although they're trying to say she died from hypothermia, I'm not finding too many gross findings that will clarify that. I'm not seeing too many things that would say, oh yes, she really did die of hypothermia. But I am seeing other things. So let's go. Notice how they perform. Let me see something. Notice how they perform the neck dissection. Remember what it said about suspicion of neck injuries and how the exam must be done. And I'll show you this again. And that S should be an A. I know it should. Okay? But another typo. And me trying to get this information out while it was fresh in my mind, and I was, willing to explain and do what I need to do. I posted it. I didn't go back. I didn't check. Sorry. Moving on. I don't know why I keep getting light like that. Alright, so this is where I wanted to bring it to your attention again. Alright, so what did it say here? I said, notice how they perform the neck dissection. Remember what it said about suspicion of neck injuries and how the exam must be done. So I put like a reminder slide in. Okay, if there are neck abnormalities or suspicion of pressure on the neck, it is prudent to remove the cranial content, which is the head section, the section in the head, and the thoracic section, which I pointed out early on, before doing the neck dissection. So as you see, they did the cranial, they did the thoracic. Now we need to look and see how they do the neck dissection. But for them to do it in this manner simply tells us that they saw some suspicion of neck injury or abnormalities or some sort, because if they did not, they would have just plainly did the tongue and neck. They would have did like the thorax pluck, organ pluck, where they would have just took the tongue and the neck out together. But no, they did the cranial, they took the chest plate out, they looked in the head, and now they're doing the neck. Okay, let's get to that. And it says here in Canada, it is convention to do layered neck dissection. Pay attention to that, layered neck dissection. Here we go. In the neck, it say an in situ layered anterior neck dissection reveals no subcutaneous and intramuscular hemorrhage. The tongue is intact and has no bite marks or contusion. The hyoid bone, I gotta read it from the other film. The hyoid bone and the laryngeal cartilage are intact. The epiglottis is unremarkable. The atlanto-occipital articulation is stable. And here is another one. An in situ layered posterior neck dissection reveals no subcutaneous or intramuscular hemorrhage. No cervical fractures are visualized or palpated. So again, they did a layered, let's see what it say. You know, it is convention to do a layered neck dissection. Okay, so that's the key word, layered neck dissection. Here it is, layered anterior neck dissection, and a layered posterior neck dissection. So basically they did a layer dissection of the neck, because I believe somewhere I read, let me go back again, let me see. Is it here? Maybe not, but I may have it somewhere. Alright, so as you can see, this post-mortem exam basically let us know that there was some neck abnormalities or suspicion of neck injury without actually saying it. Everything that have a purple marking or underline is to point out how and why the postmortem exam was done in that order. The medical examiner saw suspicion of neck injury, but it was not. Wait, let me say that again. The medical examiner, the ME, saw suspicion of neck injury, but it was difficult to prove, so they had to agree with the authorities. That was my point. Okay. And just because they don't see anything do not mean it's nothing there. For an example, read this information and judge for yourself. Remember how the autopsy is worded. For all we know, this could have been the cause of death, but the goal is to make us all think otherwise. So basically what I'm saying is this autopsy is being worded in a way to confuse us. They want us to believe Kenneka died of hypothermia, and they could not prove their suspicion or what they thought, so they just agreed and just went on a circumstantial standpoint of what Kenneka could have died from. But if all of that is what happened, that takes me all the way back to the beginning, from the hypothermia. Okay, why is it that they didn't do the things necessary when they found her being supposedly frozen solid? Is it because they knew she was already dead, and because she was found in the freezer, and because they already fucked up, they needed to find something, you know, to pin it on? You know, hypothermia. We can't explain none of the other shit, and we're just going to say hypothermia. But yeah, all of this is crazy. You know what I'm saying? So when you really look into these autopsies, it's amazing how we could miss so much information because we don't understand what we're reading and we don't understand what we're looking at. And you have to literally break this shit down. You literally have to research and type in certain words and phrases and shit that they use to see what is it that they're saying, you know. And what gets me is I can't believe people that understand autopsies and doctors that know exactly what to look for didn't look at this autopsy and say, that's some bullshit. We need to put this information out there. We need to let this family know, like, something is up with this autopsy. But then maybe it's some sort of code of ethic or something. When you're a pathologist, when you in the, you know, in that type of, if that's your, you know, type of work that you do, you can't step on the toes of somebody else. You can't sit there and say somebody conducted something wrong because that jeopardized their license, and you don't want to be the cause of their license being jeopardized. You just want to continue to work and do your own thing and not worry about what the next man's doing. I don't know, but I really think some professional pathologists, you know, they have way more knowledge than I do, that could explain it way better than I. But I'm doing the best I can with the little bit of researching that I found and putting this together. Like, I really think that I'm coming up with some legitimate stuff. Homicidal smothering. Okay, and I put certain little examples in here to show the possibilities of her dying of something other than hypothermia. Okay, the homicidal smothering. They say homicide is possible where the victim is incapacitated from drink or drugs, very weak, child or older person, illness, and the victim is stunned by a blow. Usually the mouth and nose are closed by a cloth or a hand, or the face may be pressed into a pillow. So this could have possibly been a situation. You know, Kenneka was drunk. You know, we saw her staggering. She had a little pill in her system that wasn't lethal, but her motion, her body movement, like I said in one of my videos before, she wasn't quick reacting. You know, she probably was caught off guard. Like I said, when she looked to the side to see past that wall, that's when she could have been startled, or she saw somebody that she knew, didn't think they was going to harm her, and they did. Like, it could be anything. But I'm putting this out there because hypothermia is just not clicking to me. That's just not fitting the situation. Okay. In some cases, death due to reflex cardiac arrest and asphyxial signs are absent. So, this could be one of those cases. Due to reflex cardiac arrest, meaning she could have had a cardiac arrest in her situation, which meant the asphyxial signs and the asphyxial signs are absent. Basically, the suspicion of neck injury and the abnormal neck injuries or whatever, they couldn't report any there because it was absent due to the reflex cardiac arrest. You feel what I'm like? You see where I'm getting at? Like they only giving us what they can, or maybe they know something and just like omitting information. I don't know. Signs of asphyxia are faint or absent in a case of plastic bag suffocation. Moisture usually collects in the bag. Plastic bag suffocation? Okay. I should have did a better one. Let me see if it's alright. I'm gonna go back. The lips, gums, tongue may show bruising or lacerations. The tongue may be protruded and may have been bitten. So this is and I wish this wasn't up there. Originally it wouldn't have been, but I'm gonna just work through what I got. I'm not starting over. Look at the lips, you know, how it looks to be a little bruised or bitten or peeled or whatever. And then I believe this is the tongue. This is what it looked like, you know, if those things have happened. Although signs of asphyxiation don't always show, the medical examiner still have to report if it's visible or not. So they reported that they saw no signs of these things because it didn't show. But once again, it don't mean it didn't happen. Depending on how let's go back. That's what it say. In some cases, death is due to cardiac arrest and asphyxial signs are absent. So she could have had a cardiac arrest in a mix of what she was going through. Now, I put this here and I circled her lip because it looks similar to here. Okay? The lips, gums, and tongue may show bruising or lacerations. That's what we see here. When they say she was beat up, no, that may be the laceration or the bruising from the asphyxial or cardiac arrest, reflex cardiac arrest. The tongue may protrude and may have been bitten. We don't know if her tongue was bitten, but they said it wasn't. We can't prove that it was or wasn't. We can only go by the medical examiner. But you see I'm pointing out the way the lip here. You know what? Let me see if I could. I don't know why I did this early in certain things. Looking at her lip here and looking here, it's possible that could be the situation. Internal changes, blood stains, frothy fluid is present in air passages, slight acute emphysema and edema of the lungs with scattered areas of atelectasis. Hopefully I said that right. Pachia and congestions are the major findings. Alright, I'm getting to the end because right here it says, and I might have loaded my pictures wrong, but I think I've done, y'all pretty much get where I'm going. Okay, a case of death due to hypothermia. Clotting of blood was found in the heart, and they're showing an image of blood clogs in the heart of a person that died from hypothermia. I'm gonna try to speed it up. Alright, this is the cardiovascular system. The cardiovascular sac is intact. It say no evidence of let me make it bigger so I can see. Atherosclerosis or thrombosis. And that means, I think the A word, because I ain't want to sit here and try to keep saying it and say it wrong, but I think that was fatty tissues or liquid or something, and the thrombosis is the blood clots. So it say no evidence of those things, but it clearly state a case of death due to hypothermia, clotting of blood was found in the heart. And here they saying there was no clotting, no blood clots. They didn't see any of that. Sorry for moving it around. I'm getting anxiously to the end. Let me see what this say. I wish. Why is it? So I guess it's saying the intimal surface of the, I should have did a better job, aorta is free of atherosclerosis and free of thrombi. So they're letting us know there's no blood clots in the cardiovascular system where the heart is. Okay. I'm sorry to rush it, but I just want to get to the end. I don't want to hold you up any longer, and I don't want the video to cut off because I think I have a time limit on how much I can record before it cut off. Read what the information on this case. Wait, read what the information. I'm so sorry. I was rushing this. The case does not match Kenneka's autopsy. Kenneka's autopsy showed no blood clot, thrombus in the heart. So I already explained that. Shit. See, this is why. Alright, sorry about that, y'all. Had to get back to where I was at. Another case, due to hypothermia, clotting of the blood was found in the aorta and a pulmonary artery. Okay, and this is a case that's due to hypothermia. So I think that's why I underlined that for some reason, unless it's, let me see, I'm sorry, it must be here. Alright, so I probably didn't mean to put that extra clip in there. Alright, again, the case does not match Kenneka's autopsy. Kenneka's autopsy showed no blood clot in the aorta of the heart pulmonary artery. But in figure 9, it states that death due to, I was cut off and everything. I'm so sorry. Hypothermia, clotting of blood was found. Alright. I am so mad because I'm not doing this over. Respiratory system. The upper airway is clear of debris and foreign material. The mucosal surface are smooth, pink, tan, and unremarkable. The pleural surface are smooth and glistening with no focal lesion. The pulmonary parenchyma is deep purple, exhibiting slight to moderate amounts of bloody fluid upon sectioning. I highlighted that for a reason. I'm going to see if it's in the next video. If not, it might have been in the one before. It say no mass lesions are noted. There is mild anthracosis. The right lung is bilobate. No middle lobe is present. The pulmonary artery are normally developed, patent, and without thrombus and ebolus. The right lung weighs 238 grams and the left lung weighs 193 grams. Alright, this right here, the pulmonary parenchyma is deep purple, exhibiting slight to moderate amounts of bloody fluid upon suctioning. I'm thinking, let me see if I gotta go back. Oh, wait a minute. It must have been here. I'm I'm sorry. I feel so bad trying to find this information. Alright, well, anyways, this here means something. And I'm going to find it. I feel bad, y'all. Kenneka autopsy show no blood clot in the pulmonary artery, but her respiratory system do show other issues that relates to death by asphyxiation of some kind. The middle lobe could have possibly collapsed due to the respiratory failure. This might be what I was trying to get to. Obstruction by bed clothing, a pillow, a cushion, etc. applied with skill may not leave any external signs of violence, especially in the very young and the old. The physical signs and symptoms are severe because death usually results due to asphyxia. If the orifices are closed by hand, there may be scratches, distinct nail marks, or lacerations on the soft part of the victim's face. Alright. Yep, that's probably what I was underlining. General. Oh, shoot. Oh, my gosh. I'm sorry. Y'all gonna kill me. General autopsy finding in the asphyxial death. The followings are general findings in death by asphyxia. Their prominence will vary with individual cases. Pt1 hemorrhage, in particular, may be completely absent or extremely rare. It is also important to note that all of the findings in asphyxial death may be found on occasions in other circumstances. Pulmonary edema with froth in trachea and bronchi, bulky crepitant and over distended lung, right ventricular dilation, Pt1 hemorrhage on the conjunctival and facial tissue, usually above the level of the airway, obstruction and strangulation cases. I'ma just apologize all the way through because I am messing up. I'm looking at the time, thinking about work tomorrow, and at the same time, I'm just trying to get this information out. I promise if I do more videos, it will be better. I haven't been doing this for long, but as you see, I am showing y'all some valid information. I hope y'all like what y'all, like the information that I gave, and maybe y'all could kind of put it together and see what really went on. I was trying to find a way of doing this where I didn't have to do all of this reading and explaining and all of that and putting my little input, but it didn't work out, so that's why I'm to this point. And I do apologize for all the stuttering and mispronunciation of the words and not able to find certain things because I really was just trying to rush and get this out of here. So my apologies. Suffocation. Suffocation results from the mechanical obstruction to the entry of air into the lungs by obstruction of the external respiratory orifices. Common agents used are plastic bags, soft pillows, or soft material used to occlude the mouth and nostrils. Smothering can be homicidal, suicidal, or accidental. In homicidal suffocation, there is usually considerable physical disparity between the assailant and victim, or the victim is debilitated by drugs or injury. Scene investigations may not be helpful. Some cases of sudden infant death syndrome have been, well, I didn't really need to read that.